Welcome to Medical News Update, health research translated into plain English. Today's story, one of the biggest questions about weight loss drugs like Mounjaro and Zepbound, what happens when you stop taking them? A new trial called SURMOUNT-MAINTAIN gives us the clearest answer yet. The drug in question is Tirzepatide. You know it under the brand names Mounjaro for type 2 diabetes and Zepbound for weight loss. It is one of the most powerful weight loss medications ever approved. But there's always been a question hanging over these drugs. They work until you stop. And many patients do stop because of cost, insurance coverage, side effects, or simply because they reach their goal and don't want to keep injecting. So what happens then? The SURMOUNT-MAINTAIN trial, published in the Lancet, set out to answer exactly that. Researchers enrolled 441 adults with obesity or overweight, plus at least one weight-related health condition like high blood pressure or sleep apnea. Importantly, this trial did not include people with type 2 diabetes. We'll come back to that. For the first 60 weeks, everyone took weekly Tirzepatide and worked on diet and exercise. They lost weight, often a lot of weight. Then, 378 participants who had lost at least 5% of their body weight and could tolerate the drug were randomly split into three groups. Group 1 kept taking their highest tolerated dose. Group 2 reduced down to a smaller 5 mg maintenance dose. Group 3 switched to placebo. In other words, they stopped the drug entirely but kept the lifestyle program. Then researchers followed everyone for another year. At week 112, here's what the average weight change looked like compared to the very start of the trial. The group that stayed on their full dose was down 21.9% from baseline. The 5 mg maintenance group was down 16.6%. The placebo group, the people who stopped the drug, was down only 9.9%, meaning they regained a significant amount of the weight they had lost. So staying on the drug, even at a lower dose, kept most of the weight off. Stopping it allowed weight to creep back. Why does this matter? For decades, doctors and patients have treated obesity as a short-term problem. Lose the weight, then move on. This trial confirms what specialists have been saying for years: obesity is a long-term condition, much like high blood pressure or type 2 diabetes. Most patients who stop their treatment lose their benefit. That's not a moral failure, it's biology. Your body actively defends a higher weight set point. These drugs work because they keep that signal quiet. Stop the signal, and the body fights to climb back up. The trial also gives us a useful practical option, a lower dose maintenance approach. The 5 mg group didn't do quite as well as the full dose group, but they did much better than placebo. That matters because lower doses can mean fewer side effects and lower cost. A few important caveats. This trial did not include people with type 2 diabetes, so the results may look slightly different in that population. And many real-world Tirzepatide users do have type 2 diabetes. Side effects were the familiar ones: nausea, diarrhea, constipation, vomiting. Most patients tolerated the drug, but some did not. And please do not change your dose, stop, or restart this medication on your own. This is a conversation with your prescriber. What does this mean for you? If you or someone you know is on Tirzepatide for obesity, think of it as long-term medical care, not a short-term tool. Plan for it. Discuss maintenance doses with your doctor. And build the lifestyle habits: protein, fiber, strength training, sleep that protect the weight loss alongside the medication. That's today's medical news update. Share this with anyone on or considering these drugs. Until next time, stay curious, stay healthy.